Hey everyone, I'm back for my third installment. So this is 3 weeks post-op with my bicep rupture repair, recovery, whatever you want to call it. Anyway, it's been 3 weeks now since the operation. Cast was removed after 1 week, and then went and saw a doctor. He wanted me to wear the sling for 4 weeks. Instead, I wore it for 1 week, and I also removed the band-aid that was on here last time you saw the video. You can kind of see how it's looking now. It's not bad, actually. I mean, you can feel the scar tissue in there. It's a little puffed up, but this side looks real nice, and then this side, is a little more three-dimensional, I guess. My range of motion is quite good. You can see this arm, both. I can't go up all the way yet just because I think there's a lot of swelling still in the elbow joint region. That's about as far as I can go. But I can push it, I can push it all the way up to here, but there's no way I can make the muscle pull it that high. It just doesn't work that well yet. And the other thing is I don't have full range of motion with my wrist rotation. See, this arm comes all the way here. This one, not quite. And as far as the opposite direction, it's not quite there either. So that's probably the worst thing is, you're trying to drive and you just can't with the steering wheel and go all the way around. You have to use your good arm a lot more than your bad arm. But like I said, it's only 3 weeks post-op, so I shouldn't even be anywhere close to doing probably what I'm doing right now. As far as the muscle itself, I can actually, flex it already pretty nicely. That's about as hard as it's still kind of soft. I can't flex it very hard, it just doesn't have the ability. I don't think the connection, the bone growth and all that has completely formed yet in the arm, and it's a little tight here too. I can press on it and feel a little bit of pain here. A lot of it's still very numb. Like this whole area of my forearm really has no feeling. And when you do your wrist rotations, all the pain is actually in here, a place where you didn't have surgery, but for some reason, I think because of the nerve damage or nerve bruising, whatever they want to call it, I think that's the main issue with the pain in your forearm. I don't know, I'll see the doctor again in 3 more weeks. And you can see it's still a little bit bruisey looking here. If you can see the color, I guess you can't really see the color. It's too bright in here, but but overall I think it's been great. Still have the strength, but it's coming along. Only been 3 weeks, and I'm 50 years old, so I'm on the older side of things. My healing's probably a little slower than it might be if I was a younger person, but I can do planks already. I can do push-ups already. Of course, I can't do any sort of curl. I could hold like a soda in my hand for a little while, but then it starts to hurt after a while. That's about as heavy as I go right now. But anyway, that's how it is, and that's how it's going for me. I don't know if I'll be back next week because I don't think much can change now except for, the wrist and the bicep curls. That's about the only 2 things. And really you're not supposed to do any bicep curl strength training for like 4 months. So that's another 3 months from now at least. But knowing me, I'll probably try before that. Anyway, we'll see. I'll let you know how it goes. Till next time.